Hi, so our top topic is food scarcity in Haiti and Afghanistan, and our group members are Adia, Louisa, Eden, and Wyatt. Okay, so just an overview of food scarcity. Food scarcity is a real, prevalent, and worsening issue globally. Along with food scarcity and the lack comes the lack of nutritional food comes many health complications and poor health outcomes. According to the textbook, food insecurity is the state of being without reliable access to a sufficient quantity of affordable, nutritious food. More than 800 million people live every day with hunger or food insecurity. Food is essential to maintain growth and development of children and prevent illness. And from our textbook, it states that long-term effects of food insecurity are ill health, reduction in physical and cognitive growth and development, disease vulnerability, and if untreated, death. A large contributing factor to food scarcity is poverty. Nutritional deficiencies related to poverty also can have negative health outcomes. Our textbook states poverty affects nutrition throughout the lifespan, causing both infectious and non-communicable disease and leading to a reduced learning capacity. Okay, so an overview of Haiti. Haiti is located between the Caribbean Sea and the North Atlantic Ocean. Haiti borders with the Dominican Republic. Food scarcity is an increasing issue in Haiti due to educational discrepancies, government corruption, gang violence, and political instability. Unemployment rates and the lack of education within Haiti are closely related to the lack of resources and access to nutritional food. According to an article titled Poverty in Haiti, still the level of unemployment stops parents from sending their kids to school, although education is emphasized as inherently related to well-being and to the development of the country. Without a proper education, it is hard to get a good job that can manage a good income. Therefore, families cannot make better financial decisions due to the lack of education. And then poverty is prevalent in the majority of Haiti's population. The same article states poverty in Haiti is so excruciating that the majority of the Haitian population finds it almost impossible to meet their basic needs, such as shelter, education, and health care, clothing, food, just to name a few.
Just an overview of Afghanistan and a little bit about the history and problems with food scarcity in Afghanistan. Afghanistan is a country in South Asia. Afghanistan has a population of around 40 million people, with the majority of the population being Islamic, which kind of impacts the effect of food scarcity. And with there being a war going on, the 99% of that impacts the women a lot. Food scarcity has been affected by the droughts and the ongoing weather in Afghanistan, as well as the pandemic and the Taliban taking over Afghanistan. Other impacts are the primarily impact of women and children who resort to unacceptable methods to meet basic needs to survive.
So some of the major issues in Haiti, like Eden had previously mentioned, include economic instability. Haiti is deemed the poorest country in the Western Hemisphere due to their dependence on external revenue, natural disaster responses, and just debt that they have accumulated, which has really set back their development as a country and put a huge strain on their economy overall. More than half the population in Haiti is living below the poverty line. Many of these citizens have very limited access to resources and healthcare, and 22% of children are chronically malnourished. Another major issue in Haiti would be their political instability. Their democratic system that was just recently developed in the late 1990s has had a variety of leaders that have created a lot of turmoil within their nation. Jovenel Moise, I think, was elected in 2017, and under his reign saw a lot of uproar and protest due to his impact on their economy, and then was later assassinated in 2021. This then led to a new president, but with this new president in order, gang violence grew a lot stronger and has taken over much of the nation in response to the disorder within their system. One last huge issue that Haiti faces is the effects of natural disasters. Over the last 4 decades, it has been observed that Haiti has experienced a natural disaster almost every year. Um, and in 2016, Hurricane Matthew hit the nation tremendously hard, leaving over 2.1 million people, with 4.1 million of those people needing medical assistance in some kind affected. Due to their reliance on crops and agricultural development for resources, natural disasters increase food and resource security throughout the population when these disasters strike.
So the major issues in Afghanistan are drought-like conditions. Since 2017, Afghanistan has experienced drought-like conditions, significantly impacting agriculture. Unpredictable weather conditions have led to the death of hundreds of livestock, resulting in 40% loss of crops. This is overall caused when they believe that no more snow is gonna come during winter-like conditions, and farmers think that they're able to just bring out their cattle, but just the weather comes unpredictably, and then many of the times they just end up dying because of how cold it is, and they have to go so many miles away just to receive food. Another major issue was COVID-19 pandemic. The COVID-19 pandemic has caused increased food prices, high unemployment, and income losses, as well as disruption in food supply chains. And another major issue is the Taliban takeover. Food insecurity increased significantly in 2021, rising from 70% to 98%. As a result, the rate of malnourished also grew, leading families to resort to desperate measures to meet basic needs, such as selling their children, selling their kidneys, as well as giving medication for their children so they can go to sleep even though they're very hungry.
Just some general food statistics regard food scarcity statistics in Haiti. Nearly half the population, 5.4 million people, are facing high levels of acute food insecurity. These classifications in these areas have been determined to be in the crisis or even worse conditions, according to the IPC high acute food insecurity situation. Food prices were 23% higher in June of 2020 compared to June of 2021, with food inflation continuing to be at an all-time high. And due to these rises in food prices, expenditure accounts for 70% of the total household expenditure for the average Haitian family. 1 in 4 Haitians are currently facing acute food insecurity, and with hurricane seasons, this value increases.
Just some statistics on food scarcity in Afghanistan. In Afghanistan, 14.8 million people of the 40 million population have some type of acute food insecurity concerns. Around 3.5 million children are malnourished in Afghanistan. 1 in 3 Afghanistan citizens face threats of hunger, while 2/3 of female-led households are struggling with poverty and cannot afford necessary nutrients to support a family. The major cause of the limited access to food in Afghanistan is the combination of the ongoing war and the harsh weather conditions like flash flooding or droughts.
So in terms of global health, the intensity of food scarcity in Haiti affects all of their population at an alarming rate, but specifically children. In 2021, in a UNICEF study, over 86,000 Haitian children under 5 were projected to suffer from acute malnutrition, and then many of them were expected to die without urgent assistance. Of the 5 million people impacted with food scarcity, within that population, 1 in 2 children are impacted significantly. The lack of nutrition children may endure puts them at a greater risk for illness and disease due to their fragile state of health with their lack of nutrition. And then children facing food insecurity are put at a greater risk to fall into the cycle of poverty, displacement, and violence.
So in Afghanistan, application to global health, So the ones who are mostly affected by food scarcity are women and children. Women, it's estimated that 1 million women and girls are malnourished. Many women and girls cannot access food because they lack financial resources. Restriction on women employment makes it difficult for women and widows who are unable to work and struggle to afford necessary needs like food. And then women have less access to food, particularly balanced diets, and they miss one additional meal each week compared to men due to cultural norms. So due to this, women, when the Taliban took over, they restricted women from not having employment. Many of these women who do not have that male figure in the household cannot have a job, so they rely on borrowing from family members to be able to reach necessities, and as well as the widows who do not have anyone that can provide for them, but as well as not being able to go to work. And the culture norm that they have is that males have to eat first in their household, and many of the times only one meal is provided throughout the whole day, causing women and children not to be able to eat throughout the day. And then children, approximately almost 2 million children under the age of 5 are experiencing moderate acute malnourished, and nearly 860,000 suffer from severe acute malnourished. Some children are given sleeping medication to reduce their food intake, as said previously, and many families having exhausted all options are resorting to children marriage or selling their children, as stated previously.
Okay, so applying food scarcity to nursing in Haiti, nurses play a significant role in advocating for patients and providing them with education and resources. Within nursing practice, nurses must become educated surrounding the signs and symptoms related to food insecurity and food scarcity. This would include looking at the health of the patient's hair, skin, and nails, as well as their height and weight. In children, their growth and development should be tracked in order to tell if there are any abnormalities. Cognitive and motor skills should also be assessed. And then an example of assessing for dehydration would be looking in someone's oral mucosa or in their mouth. It should normally be pink and moist, so if it were to be cracked and dry, that would be a sign of dehydration. Nurses also play an important role in giving patients a space to talk about their struggles and concerns that they have. Nurses must ask patients questions surrounding their living conditions, access to food and shelter as well. By doing so, healthcare providers can then have better insight into the next steps they need to take and the needs of the patient. According to an article, Food Insecurity and Health Outcomes, food insecurity is associated with increased risks of some birth defects, anemia, lower nutrient intakes, cognitive problems, and aggression and anxiety. It is also associated with higher risks of being hospitalized and poorer general health, with having asthma, behavioral problems, depression, suicide, ideation, and worse oral health. This is why nursing assessment and healthcare interventions for these individuals is vital to their current and future health and well-being. A second article, a nurse-led intervention to address food insecurity in Chicago, states nurses should consider screening for food insecurity as a part of routine nursing assessments. Nurses will then need to coordinate these efforts with other disciplines to ensure that appropriate resources and follow-up measures are in place. By collaborating with physicians and doctors, patients can get access to prescription medications that they may need, as well as other interventions. Collaborating with the dietitians and community resources can provide patients with food resources once they are discharged from the primary care facility. Haiti lacks potable sanitary water, and so educating patients on proper sanitation methods could greatly lower their foodborne illness rates. Unfortunately, complete change cannot be made overnight, so nurses should focus on areas they can improve. After assessing what resources the individual may have, the nurse can then educate patients on healthy and nutritious foods based on what they have access to. They can also teach patients the importance of ensuring food is sanitary and fully cooked to avoid any illness since medical resources are limited.
Applying nursing to some concerns a patient would have in Afghanistan. There is a lot of medical complications associated with the struggles someone might experience in Afghanistan. With so many people struggling to receive food in Afghanistan, many people could have complications with malnutrition and experiencing signs and symptoms of weight loss, and weakness and fatigue, as long as drowsiness and vertigo, as well as many changes to their skin and hair. They might experience thinning hair might be greasy and falling out of their head. Their skin could be dry, paler. Other complications associated with food scarcity in Afghanistan are when women are pregnant and lack the nutrients they need so they can have an effective birth and a healthy baby. A baby and a mother that do not receive the proper nutrients they need could experience symptoms of abnormal fetal skeleton, where the fetus's skeleton does not develop properly, leading to abnormalities like shorter limbs or a softer skull. Other abnormalities include clotting. With the babies not getting enough nutrients and oxygen, there could be clotting happening in the baby's arteries, causing them to have a stroke and or pass away. Also, with the ongoing war in Afghanistan, many complications with the war can lead to injuries that can be very critical, such as hemorrhaging, infections, burns, and traumatic brain injuries, along with many effects on the patient or soldiers after the war, such as PTSD, neurologic problems, and mental health problems like depression.
And here are our references. Thanks for listening.